Hello everyone, my name is Dr. Anuj Agarwal and I am a senior resident in Radiology Department of Safdarjung Hospital. I did my MBBS, MD and now I am pursuing my senior residency from the same hospital, that is Safdarjung, Delhi. So a lot of residents messages me on Instagram or Twitter regarding what should be their approach and what books they should read in radiology residency. Since in MBBS time we do not read much of radiology. So when a person gets into a radiological branch, then there is a dilemma that what are the books they should read and how they should approach the 3 years in residency. So this video is dedicated for you. So I will answer this question by various workstations or various postings that you will get in your residency. So let's say if you are a first year resident, then you would be posted in conventional radiology. That is, either it will be X-ray reporting, or it can be fluoroscopy, that is the special investigations, or it can be ultrasound, or it can be Doppler. So these four postings you will get initially. Later on you can get a CT posting or MRI posting also if the number of PGs is more, and you can have non-vascular and vascular intervention units like DSA, which is present in our hospital, in your hospital also. So let's begin with X-ray posting. In X-ray posting, the easiest X-ray according to me is X-ray KUB and the lumbar spine X-ray. Then you will be asked to report some joint and the extremities X-ray, and the most difficult X-ray, which is also known as the graveyard of radiology, in my opinion is the chest radiograph, because the pathologies and the varieties of various diseases that can be detected on a chest radiograph are highly variable. So to read about chest X-ray, one book which is prescribed is Felson's. So Felsen is a standard book for chest radiographs, and it is useful because certain signs like thoracoabdominal sign, cervicothoracic sign, or various signs like loss of Silhouette sign, hilum overlay and hilum convergence signs. These signs are variably described at various places. So in exam you need to quote the sign from a standard textbook. You need to have a reference. So in this aspect, Felsen is a very good book, and you can have this book because it is affordable. Also you can have a hard copy with yourself because soft copy is not available on internet. And the second thing is that it is written in the form of a novel, so many people might not like it because the author gives a very long description that there was some discussion going on regarding this sign, then I went to my friend, we conducted a study over 400 patients, then finally this thing that we came to as a conclusion. And apart from that, the radiographs which are given in this textbook, they are very old, so the quality of the films or the x-rays that are shared by the author, they are not very good. So you can have Felsen, and it is very important to have it because it is a standard book, and you can read the important parts like various signs that you need to explain in your exam from this book. Second textbook for chest x-ray is Chest X-ray Survival Guide. It is a very simple book and even non-radiologist can read it, and it can be finished in around 10 to 15 days. Apart from this book, there is another book called as Unofficial Guide to Chest X-ray. I found this book very helpful because in this book, various chest radiographs are given in the form of a problem, and on the next page, they have solved that problem by labeling what are the abnormalities, so that you can understand how we should report the chest radiograph by ourselves independently. So although it is not a very well known book, it is not known to old consultant, but I found it very useful, and I advise you to read this book. All these books can be obtained as a soft copy or in the form of PDF on Telegram, and if you have any difficulty in getting these books, then you can contact me on my Instagram. You can directly message me, and then I will send you the textbook on Telegram. Then the third book that I want to tell you is about David Sutton. So you have an option of reading either David Sutton, or there is another book known as Granger Ellison. It is just like in first year you read in physiology that either you can read Genong or you can read Guyton. It is almost similar thing. But I suggest you to have a soft copy of Sutton with you. You need not to buy the hard copy because the books are very costlier, and you need not to read any book from cover to cover in radiology, because only few books, like I will talk to you about those books like Osborne Brain Imaging or Webb Thoracic Imaging. Only these two books in my opinion are those books which have to be read from cover to cover. These are so much important books. Apart from that, no other book is that much important among the foreign authors. So I suggest you to have a soft copy of Sutton with you. And regarding chest X-ray, like what is high KVP technique, what are the moguls, that is what are the parts of heart border on chest radiograph, these things, what are the signs of congenital heart disease, what are the signs of particular chamber enlargement in heart, these things you have to read from Sutton. Apart from that, Sutton reading is not so much useful because they describe the pathologies so much, and in the end you will not get any consolidated information. Then in your X-ray posting, you will have musculoskeletal radiographs also, like lumbar spine radiograph. You will report degenerating joint disease. You will have to know what is vacuum phenomena, what are the grades of spondylolisthesis, what is Bertolotti syndrome or LSTV, that is lumbosacral transition vertebra. All those things you will come to know in your postings. So regarding that, you have to read either of the two books. Either you can read Yocum. Yocum is a standard textbook for musculoskeletal radiographs, but the disadvantage is that it is very lengthy, and it can be taken as a positive point also because they describe the pathology from the very beginning in very detailed manner. So Yocum is very good book to have in first year in form of soft copy. And later on, if you find it useful, you can have Greenspan, which is another book which is slightly concise, and it has a advantage that even CT findings and MRI findings are also described in this book. So for musculoskeletal radiographs, you have Yocum. You must have that book as PDF in your iPad or laptop. And secondly, you should have Greenspan in your laptop or iPad with you. And the third book is Kaplan. I will not tell you now because it is related to MRI. I will describe with the MRI posting. So chest radiograph and musculoskeletal radiographs form the major chunk of radiographs that you get in X-ray posting. But apart from that, you get abdominal radiographs also and some other radiographs also. So for that, I suggest you to read these books, and these books can be obtained on Telegram. And if you don't find those books on Telegram, then you can contact me. I shall send you those books. In first year, you should also know that what are the positioning techniques for various radiographs. At least for chest X-ray, it will be definitely asked in your exam that how you position the patient, what is the MAS, what is the KV for a chest X-ray. So these things you should also know. In old times, they used to ask about what is transverse view, what is particular view for this part of temporal bone, such kind of X-rays. Like for Waters view, they used to ask, like we used to study in ENT. So such things are slightly rare now because we do CT more often, but still you should have a slight idea about these things. And there are certain measurement related things like how do you measure angle for genuvalgum in a patient, or how do you measure scoliosis corpse angle. These things you will learn in MSK, that is musculoskeletal radiology, only in your postings. Then the second posting you might have in DRF, that is digital radiography and fluoroscopy, simply called as fluoroscopy, or special investigations at some places. So during that posting, first you need to know how to do IVU, that is intravenous urography, what are the instructions that has to be given to patient, what is RGU, MCU, what is HSD, that is hysterosalpingography, and related to abdomen or GI tract, how to do barium swallow techniques, how to perform the barium meal follow through, and such kind of procedures you need to have a knowledge about them. So regarding the procedure details, how to do the procedures, there is a book by Chapman and the author is Nick Watson. But it is a foreign author book, there is no need to buy that book. And the book that we usually refer in our residency is this book, which is Bhushan Lakad. Although this book is not a standard book, but it is very useful book and everybody reads that book. But the problem is that you can't quote that I have studied this from Bhushan Lakad. So to quote, you can say that I have read it from Chapman, Nick Watson, but the details are same and it is given in more precise and more simpler manner in this book known as Bhushan Lakad. Along with that, you just need to know the names of certain books. Like there is a book called as White House, which is related to GI procedures like barium meal follow through, but it is very old book and it is obsolete now. New editions are not coming in the market, so just know the name White House is for GI procedures. Then similarly, there are few chapters from Davidson. Davidson is a book which is for GUT, that is genitourinary tract, like intravenous urography procedure related book it is. And few chapters of Davidson our seniors used to give us in the form of photostat, and they used to have details about what are the various patterns of nephrogram, like what is striated nephrogram, what are the causes of unilateral or bilateral striated nephrogram, such kind of things. So you just need to remember the name, that such book with the name of Davidson comes. Then one very important book is there which is known as Eisenberg. Soft copy of Eisenberg you should have in your iPad. And Eisenberg is a book in which they have detailed what are the findings and what should be the interpretation of the various imagings in GIT, like barium meal, what are the normal impressions or constrictions of esophagus on barium meal, and what are the causes of widening of C loop of duodenum on barium meal follow through, and such kind of things are mentioned in Eisenberg. how to identify whether it is ecclesia cardia or whether it is scleroderma. Such details are very well represented in that book. So you must read at least the images and the legend written in the subtitle of those images. So Eisenberg is a book that you must have in your iPad with you. So few things we have to study in radiology from articles also. RGU, MCU, HSD related things you can study from those articles. If you don't get the articles, you can message me and I will share you the articles that we use in our hospital. So the third posting you might have is of ultrasound. Ultrasound is the bread and butter of radiology. Keep that in mind that the maximum source of earning in most of the parts of India is ultrasound only. So spend adequate amount of time in ultrasound postings. Don't take long leaves and don't take ultrasound for granted. And ultrasound is a skill based technique, it is operator dependent. So suppose if you are very skilled, you can find a distal ureteric calculus also. You can trace the ureter throughout its course till you find a calculus. And suppose if the other person is not that much skilled and not that much trained, he will just say that hydronephrosis is seen. Similarly, certain ultrasounds like musculoskeletal ultrasound of shoulder joint, of hip joint, they also come in emergency to find out whether septic arthritis is there or not. And certain ultrasounds like TRUS, that is transrectal ultrasound, transvaginal ultrasound, certain ultrasounds are not very commonly done by everybody. I suggest that there is a book called as RUMACK. You should buy a soft copy of that book. The hard copy is not suggested because it is very costly and it is not that much worth it to read the book from cover to cover. Why? Because suppose acute pyelonephritis you are reading, so they will describe the study, that the study was conducted in 800 patients, the findings were this and that. In 60% cases it was found to be hyperechoic, in so and so cases it was found to be isoechoic. So it can be anything. So after reading 2 pages you will feel like I have not gained any consolidated thing. It can be anything. So RUMACK is a book which you should read in retrospect or related to particular areas like what is gut signature, liver and gallbladder you should read from it, and obstetrics you should read from it, how to measure the BPD, FL, NT, NB, such kind of things you should read from RUMACK, but you should read in the form of soft copy or PDF. Another book is WHO's Palmer Manual. It is slightly easier book, but still I prefer that you have to read one book, so prefer RUMACK, which is more often followed, rather than going for a very easier book, very simpler book, which is WHO's Palmer's Manual. For ultrasound, I would suggest you that since it is an operator dependent technique, you have to acquire the skill by doing the ultrasound, by holding the probe yourself. So spend time in doing the scan. Even if your senior doesn't give you the probe, you should reach your workstation slightly earlier. For example, if 9 o'clock is the starting time, you may reach at around 8:40 and you can take a patient, you can do the scans yourself and you can confirm the findings with your senior once at 9 o'clock the senior comes. Secondly, you can make use of YouTube videos and various websites, like there is a website called as Sono World, and there is a YouTube channel by the name of 123 Radiology. Such channels are there. They show how they are doing the ultrasound in a real time format. So these videos are more useful to you by seeing how they are doing the procedure, how they are making the patient to change their posture, and where they are keeping the probe, how they are tilting the probe. You will grasp things more easily. Another posting might be Doppler. So Doppler is actually colored ultrasound. For that, most often you will get varicose vein patients, some soft tissue malformation, vascular malformations, or varicocele, such kind of patients you will get. You can get IUGR, that is obstetric patients also. So initially you should just have a soft copy of the book named as Zwibble, and from Zwibble you can read about what is the vascular anatomy of the lower limb, upper limb, for doing the DVT scan, for doing the peripheral vascular disease scan, or for doing the varicose vein scan. Later on you can add on by studying what are the vascular malformations, and you have a radiographics article for that. And for IUGR and FGR I have made my notes by compiling from various places, and you can read those also. Thereafter you can have your posting in CT scan. So initially the easiest part of the CT scan is reporting NCCT or CCT head. Then there is PNS CT also, and there is T-bone CT also, that is temporal bone CT. So these three CT scans are found to be very easy and the simplest one. So first of all you should have a knowledge about anatomy. What is the normal anatomy of brain? What is centrum semiovale? What is corona radiata? How to differentiate them? And what are the CSF cisternal spaces? What is the importance of them? What are the parts of basal ganglia? What is interthalamic adhesion? Such kind of things you should know. and that will help you even in emergency, because in our hospital the first year sits in CT emergency and they see the scans of stroke as well as trauma. So you need to have a knowledge of anatomy at least related to CT head, and later on you can, even in your first year you should know about PNS anatomy, that is what are the paranasal sinuses and how they drain. And you have to know about temporal bone anatomy also, because in our hospital first year reports these scans. Later on in your second year or later part of the second year you can report other cases also, like musculoskeletal CT scans, they are also easy, like fracture case or something. Or you can report chest also and abdomen also. So I find that reporting abdomen CT is easier as compared to chest, because the interpretation in abdomen CT is slightly simpler. So you can see my video on YouTube related to a brief introduction of CT anatomy of abdomen, and then you can read about what is the mediastinal stations on CT chest, and what are the segments of lung, how to identify the segments of lung on a chest CT. So these things are basic for you. And neck CT is very difficult and people have a kind of fear from neck CT. Why? Although it is not difficult, but the reason is that you report neck CT less often. For example, in emergency you will report more likely head CT, thorax or abdomen CT. Neck CT people report slightly less commonly, so they just lose a touch, and therefore it becomes slightly difficult when all of a sudden they are given a case of neck. So you can keep the neck CT for later part of your residency, like in second year you can read it. And for a neck CT I have made a YouTube video and you can refer to that video also for knowing the anatomy of structures on in neck CT. So the next posting is MRI. In MRI, the first book that you must have in your hand is this pocket book, or this is a small handbook which is known as MRI Made Easy. This book is very student friendly. You can understand the concept very easily, and the most important part of this book is that what are the contraindications of doing MRI and how do we select that which sequence we should do in which kind of patient. So this book you should start reading from your first day of posting in MRI. Second thing is that initially you are asked to report brain cases. So brain anatomy on MRI you should know. For that I can share one book which is known as Diagnostic Imaging Series, and they have detailed the anatomy with the use of drawings and the corresponding CT and then corresponding MRI images, and labeling has been done, and along with that some theory has also been given. So I found that book very wonderful, and you can use that book. Secondly, you can use YouTube to know the anatomy, because this is the era of YouTube and social media. And third thing is that the most important book that I find in radiology is one book named as Osborne. So Osborne Brain Imaging you must have as a hard copy with you, but just ensure that new edition is not going to come within your 3 years of residency. So if the new edition is expected to come, then you should have a soft copy with you till that time. But having a hard copy of Osborne is very important, because it is one of the book which has to be read from cover to cover, and it is very productive and it is very high yielding book that will give you so much details and practically important things to know. So in first year you should know about brain stroke, that is what is the vascular anatomy, what are the signs of stroke, and you should also know about trauma. And later on as your residency will progress you can know about brain tumors also, demyelinating disease also, depending on whatever case you are dealing with. Another book in MRI posting is Kaplan, that I told you before, but you will report musculoskeletal MRI cases like knee, shoulder, or elbow, such kind of cases, or hip case you will report later on. So you can keep that for later part. But the important thing is that the lumbar spine MRI or the cervical spine MRI, the spine MRI you have to report in your first year only. So you can use Kaplan. One book that I forgot to mention you is Web, that is thoracic web. This is a book for chest radiology, and the book is very high yielding just like Osborne. So you need to buy a hard copy of that book, because it is very fruitful to read this book from cover to cover, and that will give you details about chest x-ray also, because in the initial part of every chapter they tell the details that you get on the chest x-ray, then they will tell the details on the CT. So this will strengthen your skills and your knowledge for reporting chest x-ray also, as well as HRCT or CECT chest also. The another book which is by the same author but is dedicated for HRCT chest, you need not to read that book, and you need not to get confused and buy the wrong book. There are few books by the name of Dr. Ashu Seth Bhalla, who is a professor in AIMS. The most important book written by the author is HRCT Temporal Bone. It is a very short and small handbook kind of thing, but it is very useful, because the author describes the temporal bone anatomy in very lucid and very good manner with lot of examples from the AIMS hospital. So you can buy that book, it will be very fruitful. Even now I am in third year of my residency, senior residency, and many of the juniors, many of the seniors ask me for that book, because that book is so much important and no soft copy is available anywhere on internet. Another book is Sinonasal Imaging by the same author, that is Dr. Ashutosh Bhalla, that you can consider buying, and I have the hard copy, but it is not as much useful as the temporal bone imaging book by the same author. You can have Sinonasal Imaging by the author also, and if you don't want to read from that book, then there is another book named as Haga, and Haga is a book for cross-sectional imaging. So it will tell you the details of brain also, chest also, neck also, every part of the body. But I discourage you to buy Haga in form of hard copy. Why? Because brain part you will study from Osborne, that is covered from there. Okay, and temporal bone and PNS you can read from Haga. It is a recommended source, but you can read it from Ashutosh Bhalla madam's book also. Then there comes neck. You can read it from Haga. That is an authentic source. I will recommend you that. But again, coming to thorax, you have to read web for thorax. So reading thorax from Haga is not recommended. Everybody will read thorax from web only. Then coming to abdomen people read from Haga, but in the final year they will buy a book called as Berry. So Berry is a must buy book. You must have that book with you, and just ensure that the new edition is not coming. And suppose if the new edition is about to come, you can get the latest soft copy from me. And suppose if the edition is not changing, then you must have to buy the hard copy, because you have to keep revising Berry before exam at least 5 to 6 times before writing your MD or DNB exam. And Berry is very consolidated book. It has gathered the relevant information from all the places, like from all the international authentic books as well as from all the authentic articles. It has compiled all the information in form of 3 or 4 volumes of books. So Berry is a must buy book. So people like me, they read abdomen from Berry itself. So again, Haga is not that much useful. So therefore I am saying you that Haga you should not buy. You should just have a soft copy or PDF book in your iPad, and you can read temporal bone and PNS from Haga as well as neck from Haga. Apart from that, everything like brain is covered from Osborne, chest is covered from Webb, and then abdomen you should read from Berry itself, because ultimately you have to read Berry. So why not reading Berry in the second year or in the first year itself? This is just my personal opinion, but consultants might not like it, because Berry is an Indian author, and our Indian consultants have a aversion and have a kind of opposition to Indian authors. So you should not quote that I have read this thing from Berry. You can quote it like I have read it from Haga, I have read it from Osborne, but even if the information is used from Berry, because Berry has authentic information compiled from all the reference books. So that's all from my side. Lastly, if you want to know about how to read physics in radiology, then you can message me, then I will make a separate video for that. Thank you. Bye bye.